Following the onset of the global coronavirus pandemic, orthopaedic services at NHS Golden Jubilee were suspended. But now, after months of careful planning, clinical teams have developed a governance framework for the safe resumption of elective orthopaedic services. Despite the many challenges still facing healthcare services, we have put in place green pathways which not only help the services get back on track, but enhance the experience for patients and staff in orthopaedics. To reduce footfall into the site, we have rolled out NHS Near Me video consultations with all patients, which reduces the risk of infection as well as the need for patients to travel here. The patient pathway has also changed, where all patients are now tested for COVID-19 before admittance, and part of the post-operative process is quicker to get patients home earlier than normal. To reduce the amount of time patients spend in our hospital, we have introduced an additional pathway to our enhanced recovery process to support day of surgery discharge, day zero, for patients receiving hip procedures. This means that eligible patients are discharged the same day with benefits for both the patient and NHS Golden Jubilee. The system can only work through our dedicated staff working collaboratively with each other and with patients, and we have audited clinical outcomes to demonstrate that these pathways are successfully green. Here's how it all works.
The arthroplasty outcomes team was using the Near Me prior to COVID for our remote patients in the Highlands and Islands. It was a way to be in touch with them and to prevent them coming back to the Golden Jubilee for their review clinics. We then progressed, once COVID hit, we extended that service to the patients who already had surgery and were waiting for review. So we carried out some telephone and given the opportunity for doing Near Me clinics and seeing us in a face-to-face virtual capacity. It gave them a reassurance that they were doing fine, and also gave them that kind of face-to-face contact that they were missing by doing a telephone consultation. So we've increased the use of it throughout our service, especially because the Golden Jubilee sees patients from a national perspective. It prevents that footfall within the hospital, remaining that COVID-light situation, also prevents patients travelling, gives them that face-to-face reassurance from a virtual perspective. Also lets us see how they're actually doing than being subjective about it. There's every potential that we could manage to see as many patients as we did on a standard footfall clinic day, and that is the hope that in the going forward that we will have that drop in footfall at the Golden Jubilee, and it will be more done on a virtual basis, both pre-operatively and post-operatively.
We've always had an accelerated enhanced recovery programme, and we've felt that there's been a few patients already that have been very much ready to go home on the first day of surgery. So we felt that it was time to trial it. Obviously we're during the pandemic, the coronavirus, and just getting back started with our recovery programme, and with this in mind we're really keen that patients spend as little time in hospital as possible so that they're exposed to minimal risks. So even though this is something new for us, we still felt it was a good time to trial this. At the moment, in our first phase of recovery following the coronavirus, we're looking at fit and healthy patients in any case. So these are the ideal patients for day case hip replacement. We have a few criteria in place. For example, they need to be able to get to a hospital fairly quickly when they go home, just in case there are any problems. They need to have a relative with them, and they need to have good transport. One of the things that particularly the occupational health therapists and the physiotherapists found is that they collaborated quite well with this, and rather than seeing them individually and separately, because there's lots of parts of their pathway that overlap, they went in to see the patient together, and they felt that they moved on much more quickly with that process, and there was less duplication. So there's been some learning points from that as well. I mean, one of the key features always is how well our nursing staff cope with change, and certainly, you know, a lot of credit has to be made to the nursing staff in the Jubilee, because they've really helped push this. The whole process revolves around a slight change of pathway. So, you know, there are pressures on the nursing staff to work hard to get the patients rehabilitated, you know, more quickly. And certainly in this case, we had, you know, one dedicated nurse who was really key in helping this work so well.
It worked so well. I called the patient the next day just to make sure. It was for our own peace of mind as well. It's something that we're new to doing. So I gave him my phone in the morning just to make sure he was all right. I had seen his wife the night before when I was discharging him, and I think she was probably a little bit nervous, as you can imagine. She was a bit nervous taking him home. So I spoke to her and spoke to him, and they were both delighted at being home. Got a really good sleep in their own bed, had no real issues overnight, and were quite happy with everything that had happened, and felt like their journey was really good and they were happy and they would do it again. So hopefully when I phone the next person, they'll have exactly the same experience and they'll be really happy to be at home. I think you always recover better when you're in your own bed, you're in your own surroundings, you know where everything is and it's close by to you, and your family are there as well to distract you if you're a bit sore. When he got home, he went for a walk around his garden, so he was obviously feeling well and feeling good. But yeah, very active man, you know, was prior to the surgery was very active, and it was his hip that was limiting his day-to-day activity. So once we can fix that, we can start getting him back to his normal, which is obviously what you want. If we can fix that part to make your life so much better and back to normal, or even better than it was before, then let's do that. Let's get you in and get you home as soon as we can to enjoy the rest of the life that the hip's given you. I think we're really lucky here because we're a really close team. The MDT work really closely together. The nurses work really closely with the physios, the OTs. We have good relationships with the surgeons as well. So we always communicate very well anyway, and the fact that we do have those good relationships working together, I think that made it quite seamless on the day, and I think that would continue as well. You know, there was nothing, although it was a new pathway, there was nothing that we thought, oh, we've not done that part right because I didn't speak to the physio or whatever. Anything like that kind of seemed to go quite well, and I think it is just testament to the good kind of working relationships that we've all got. Everything that's been going on in the world since March, and it's all been so uncertain, and there's been lots of changes in the whole of the health service because of COVID. It's been really lovely to kind of get back to elective orthopaedics and in the first couple of weeks do something so exciting as well. It's been really good, and I think it's kind of ignited a lot of people's passion again for the job that they have, because things are changing, things are always happening, and if we can keep doing it for other patients, I think it'll be really good.